My mother's 74 years old, and she lives with my sister, but probably in the next 4 to 6 years, she's going to get to the point where it may be difficult for her to live alone. She's impaired. She's handicapped. She walks around with a cane. And so, I worry about her falling, those types of things. But if you think about her age bracket, and she was born in 1949, that particular age bracket has actually had a quite a bit of an exposure to the internet and connectivity online. So they have iPhones, they have iPads, they're used to FaceTiming with their families, they understand what Zoom is. They've gone through the pandemic, so when they were joining church services, they did those through Zoom. They understand enough about technology that they have a level of dependence on technology. And the reason I'm saying all of this is because we do a lot of work with long-term care, and as these folks are starting to age into the long-term care time period, they're going in with a very high level of expectations for these facilities and what these facilities are going to be able to provide to them in terms of services for communication. And it's going to be incredibly important that these facilities have focused on what they need from an IT infrastructure perspective to be able to support those things. Because what happens when it doesn't work, they get frustrated, they get angry, they complain to their families. Their families then come in and complain to the facility, and then this degrades overall services and causes frustration with the staff. And so now's the time for all of these long-term care facilities to get out in front of these types of problems. Stop putting up with the status quo with bad networks that affect telehealth calls or bad networks that impact the residents' ability to communicate with their families. Nobody knows when it's going to be the very last time they got to talk with one of their loved ones. So relying on technology to be able to have that communication is more important than it's ever been.